First of all, I would like to thank Dr. Ali for the invitation to discuss this interesting article currently in press in gastroenterology entitled Impact of IBD Medications on COVID-19 Outcomes. As previously demonstrated by this group led by Dr. Ongaro from Mount Sinai, we know that IBD medications, particularly biologics, were thought to be safe and not increase the risk of COVID-19 hospitalizations or complications. Surprisingly, smaller studies had demonstrated that mesalamine actually increased the risk of COVID-19 complications, including hospitalizations and deaths. This study now is an update from the initial study that is a collaborative international registry, HIPAA compliant and provider reported, involving 6 continents and multiple countries, now with an overall 6,000 patients. In this study, they were able to, because of the larger number of cases included, perform a more robust analysis, as well as analysis of subgroups. And interestingly, they confirmed the fact that IBD biologics, including anti-TNFs, interleukin 12 and 13, and anti-integrins, do not increase the risk of COVID-19 related complications. In fact, they are protective. And this is very reassuring for most of our patients, and this is a question that comes up a lot. Interestingly as well, 5-ASA products were not associated with increased risk of hospitalizations or deaths. This is also very important because this was a surprise to the community with the initial studies that had demonstrated a higher risk. Finally, corticosteroids. We know that those are generally thought to be bad when associated with COVID. Indeed, this study confirmed that negative association, that there is increased mortality and increased deaths related to corticosteroids. Finally, an interesting study from this registry was that combination therapy, when done with thiopurines, increased the risk of complications, but when methotrexate was used, there was no such risk. There are still open questions here, and one of the relevant questions would be, what are the impact of the JAK inhibitors, such as tofacitinib, on the outcomes of these patients? Unfortunately, although this registry includes over 6,000 patients, they were underpowered to be able to answer that question. So that is something that is yet to be known. In summary, take-home points is that for your patients, you can reassure them that IBD medications such as biologics do not increase your risk of COVID-related mortality or hospitalizations. 5-ASA products are safe, and corticosteroids are bad.